All right, so welcome to this presentation focused on IBD clinical research and hosted by the Crohn's and Colitis Foundation. We're pleased to offer education and other helpful information to those living with IBD. So my name is Nathan Moy, and I'm an IBD patient and member of the Foundation's National Council of College Leaders. Participation in clinical research helps investigators learn more about IBD and improve quality of care. And I'm excited to be joined today by Dr. Chung Sang Tse, gastroenterologist at the University of Pennsylvania and assistant professor of clinical medicine in Penn's Inflammatory Bowel Diseases program. So today I'll be asking Dr. Tse about questions about her research on health confidence and self-help in IBD patients.
I'm so excited to be here. Thanks so much, Nathan. And thank you to the Crohn's and Colitis Foundation for inviting me for this interview.
All right, so before we get started, I just have a few quick pieces of housekeeping. The information provided during this presentation is meant for educational purposes only. It shouldn't replace any advice you receive from your gastroenterologist or primary care provider. If you have any questions about your specific care, please reach out to your healthcare provider. The Crohn's and Colitis Foundation's IBD Help Center can offer support and information if you have any questions about Crohn's disease or ulcerative colitis, and you can access this by calling 888-MY-GUT-PAIN or emailing info@crohnscolitisfoundation.org. And you can also access all this information about research on our website. So with that being said, let's get started. All right, so Dr. Tse, can you start by telling us about your latest research on health confidence and self-help in IBD patients?
Yeah, absolutely. So currently, we have two clinical trials that are ongoing and one that is underway. So I'll start by talking about the two clinical trials that are already underway and then get to the ones that we're planning. So one of the studies that we have ongoing right now is called the CORE study, CORE, and that stands for Confidence Optimization through Resources for Education, Engagement, and Empowerment. So a little bit of a mouthful, but it does summarize into CORE. So why we named it that was it gets to the core of managing disease. So we want to optimize patients' health confidence in managing inflammatory bowel disease. So what is health confidence? So we know that inflammatory bowel diseases is a chronic disease. However, each person's experience with the disease is very different. And I was struck by this when we look at someone, on the medical charts in the paper. It seems like two people could have the same disease. Like you could have ulcerative colitis, the other person has ulcerative colitis. They have, disease involvement, degree of inflammation, or the duration of disease, or the treatment. However, when I meet someone, it turns out that they have all kinds of things going on in life. One person can feel very confident in managing their ulcerative colitis, and the other isn't. And to get at whether patients are confident in managing their ulcerative colitis or Crohn's disease is very important for their outcomes. So we found out from the IBD Course Learning Health System, which is another initiative of the Crohn's and Colitis Foundation, is that health confidence is strongly correlated with other important things like emergency department visits, hospitalizations for inflammatory bowel disease, how well people feel with IBD. Do they feel terrible? Do they feel well? Those who feel confident generally feel well. Those who don't feel confident generally feel terrible. And that's exactly the words that they say. Those who don't feel confident about managing IBD ends up going to the emergency department 2 to 3 times more and getting hospitalized for IBD 2 to 3 times more. And then also disease activity like diarrhea, rectal bleeding, abdominal pain, also much higher in patients who don't feel confident about managing their disease. So, people often ask me, is it chicken or the egg? Are they not confident because the disease is very active and that erodes into patients' confidence about managing IBD? Or is it that patients just don't feel like they have the resources and they're not confident about managing IBD and thus they have worse outcomes? So our research follow-up also shows that it's actually bi-directional, so that it goes both ways, both feed into each other, such that patients who start out being in remission but not confident, and again, they're doing well, the disease is doing fine, no symptoms, but they still don't feel confident, like they're worried for some reason in their lives, okay? And then we follow them 6 to 12 months later, they're much more likely to have a flare than those who are in remission and feel confident. And vice versa, is that those people who are in remission and then have a flare, their confidence erodes. So it goes both ways, it feeds into each other. And that's when, after seeing this data, and I was like, wow, we need to work on this health confidence. Yes, we can give medicines to people. Yes, we can, do colonoscopies. And that's important. However, managing the non-inflammatory drivers of disease burden, as in aside from medicine, aside from just treating the body or the disease or the gut, we also need to treat, the mind and the mental space, because that really affects how we function in life. Oh, so and about the research. So that's like past research. Now, currently, what we're planning is to intervene on it now. Now that we understand a bit more the importance of health confidence, now how it plays a big role in how people function in life, how they engage with healthcare, how much worse outcomes are when people don't feel confident. Now we want to build their confidence. So this is my next study. It's called the Empower study. It has a long name, but it's shortened as Empower, and it stands for Examining Multiple Self-Help Interventions to Promote Self-Efficacy and Overcome Disability in Inflammatory Bowel Diseases. As you can see, my eyes went to the other side just because I had to read that name, but it's called Empower, and it's really the letters stand for really just empowering patients using self-help interventions. So things that you don't require a medical doctor, you don't require someone prescribing you something. It's self-help interventions that are vetted for, that we want to prove that they're evidence-based and that they're multimodal, such that we're offering in this clinical trial that we're proposing to do is that 4 different modalities. So it's a book, it's an app, it's talking to someone live, and then it's also talking to a peer-to-peer who have IBD, and then it's peer mentorship. So 4 different modalities of patients resources are already existing that we just want to try and see, hey, this has actually helped people gain more health confidence and help them function better in life.
Awesome. Thank you for telling us about that. That sounds really interesting. I was wondering, can you tell us about any like challenges or barriers that you might have faced in creating and kind of implementing this study?
Yeah, I would say one of the major barriers and challenges convincing people that health confidence is important in inflammatory bowel disease, or the mental space, or the non-inflammatory drivers of disease burden or non-inflammatory factors are important in inflammatory bowel disease. Just because, it's in the name, right? IBD, inflammatory bowel diseases. So we're so focused on inflammation, get that inflammation down and look for inflammation. So look for inflammation in, let's say, testing, fecal calprotectin, colonoscopies, upper endoscopies, which every patient is aware of. And then treating that inflammation with medications, pharmacotherapies, whatever medication you're on, injectables, infusion, oral pills, rectal medications, that all those are very important. And I don't want to downplay any of it because I'm a clinician as well. So I do treat people with inflammatory bowel disease, and that's necessary. However, I think we also need to go beyond looking at the inflammation, and we need to look at inflammation, but that's necessary but insufficient to really help people live holistically in their whole lives. So looking beyond the inflammation, non-inflammatory markers like where people are living with the disease, their environment that they live in, the challenges that they face, or the kind of more like the psychosocial, the stress factors, the mental space, and the health confidence that really will play into how people manage and live with inflammatory bowel disease. And I think a challenge is convincing, not so much patients. Patients seem to really get this because they live with the disease. They're like, yes, I know when I'm stressed, my disease flares up. I just get more diarrhea or I get pain. Or if I move and transition to like different jobs or careers, my disease flare up. So patients get this. But I think sometimes I do face with other researchers is trying to convince them non-inflammation matters a lot in inflammatory bowel disease. So that has been maybe a major challenge. But, some people are very open to the concepts. Others are just like, let me think about this.
Thank you. So I know you mentioned a lot about holistic care and how patients already recognize that how important that is. Um, do you know what the best way for patients who might be listening and want to bring up the idea of holistic care more to their provider could maybe go about this in their next appointment?
Yeah, I think one of the things is exactly like you said, just be upfront instead of thinking of ways to dance around the topic, it's like, or I feel like sometimes patients are really, really nice and really polite and don't want to offend their providers and doctors by like bringing the concerns up. And I think sometimes the best way for providers, unless you tell me, I just don't know. It's like with my family members, my husband, unless you tell me, I can't read your mind. I know you very well, just like I know my patients well, but unless you say those words, I cannot like draw them out again. And really it's just like, hey, I even just like you said, like Dr. So and so, I really like the way you treat me, but there's some concerns on my mind. I really want a more holistic approach and say what you think is missing. And that way your doctor will be like, you actually have a trip coming up and you want more holistic approach because you want to, take your medications on time while on the trip, but then you don't know how. Then your doctor can work with you through their medical knowledge, medical training, and scientific, research and communities to say, oh, your injectable, it can actually be brought on your trip. You just need to put it in a little freezer bag. So just really being upfront with your provider is super helpful, I think. I would say, all majority of providers are not offended when patients ask questions, and particularly what's on their mind. That's the only way they can address it. But I do have to say, when we do part of this research, part of the core studies, we did focus groups with patients and providers to ask them what are the barriers that you face as a patient and provider for providing holistic care to building self-health confidence. And providers do say that lack of time, lack of financial reimbursement for taking care of patients outside the colonoscopy, the clinic visit, and drug prescription. It's just in a healthcare system that we live in, and that's a reality of things, is that it doesn't really give us adequate time, or nor is it reimbursed to spend, let's say, an hour really talking through issues with a patient. Although providers really do that and spend the time, but they may run behind. So part two is besides patient bringing the issue up front, whether it's writing it down beforehand, right? Or else sometimes we forget, we get flustered, or when I go to clinic appointments, sometimes for some reason I'm kind of late because of the traffic, and you just forget. So just write things down to your clinic appointments that you want addressed. Now, the other thing is, this might be idiosyncratic, but the Chung Sang Tse Foundation, the IBD Forest program, it's a learning health system where they implement this thing called pre-visit survey, where ahead of time, and you can probably do this with your provider too, ahead of your clinic visit, you message your provider or you tell them like, hey, these are the concerns I want to address at our clinic visit, so that the provider can help prepare for your concerns. So with the pre-visit surveys that we do as part of IBD Forest, and other health systems have maybe similar pre-visit surveys, is before the clinic visit, within a week or so, patients get sent in the electronic medical record system a questionnaire essentially that says, what's your top concern you want to address at your clinic visit? What are your symptoms right now? How many bowel movements are you having? Are you having belly pain? Are you having rectal bleeding, etc.? So doing a lot of the kind of more of the Q&A work beforehand, and then during the clinic visit, this pre-visit survey answers from the patient gets imported into the clinic visit, the electronic medical record system. So a lot of things are already there. So that during the clinic visit, I don't have to spend time asking, oh, how many bowel movements are you having? It's already pre-filled by the patient. And then that frees up the clinic time, the half hour or so that's scheduled to talk about other more holistic care rather than just the Q&A. So pre-clinic visit surveys may be something to do that you can either initiate or utilize if it's already available, and also just really being with your provider.
Awesome. Thank you for that great advice. So I guess kind of coming back to your studies and research a little bit, can you talk a little more about the self-help resources that were offered in your study and kind of how they impact that holistic approach you were talking about?
Yeah, absolutely. So with the core study and the Empower study, we actually use very similar 4 types of self-help intervention. The core study is the 4 interventions are offered to all study patients, and they can choose. It's a patient preference and acceptance study, which means that here is the bundle. Choose whatever you like, use whatever you want, tell us whether you like it. The Empower study that we're proposing, that we're planning to do, is we're actually going to randomize and assign patients and participants to the intervention. That helps better scientifically test how well each intervention actually work when patients don't choose it is when we assign it. So randomization, so it's a randomized control trial, but that's not what's being done yet. But it's based on the patient preference where we already invited over 200 actually. We completed this study. We have 420, that's like pretty much the exact number, I think, 420 patients in the core study, the confidence optimization through resources for education, engagement, and empowerment study. The four resources are one, it's a book. So it's an IBD cognitive behavioral therapy self-help book. It's by Melissa Hunt. So Melissa, Melissa, Hunt, like hunting, Hunt, hunting an animal, that's her last name. She is a PhD psychologist who specializes in inflammatory bowel diseases. So she's my colleague at University of Pennsylvania, and she did randomized controlled trials on this cognitive behavioral therapy protocol that takes roughly 8 weeks to do. But really, it's overall self-paced. So if you're a fast reader, want to do it fast, you can do it in 6 weeks, for example. If you kind of like take your time, do the exercises a bit more, it can take longer than that. It's really self-paced. It's a book that has multiple chapters that patients go through. It's like a self-help workbook that helps them uses cognitive behavioral therapy principles, in which case it's not so much changing your life situation, but changing what a person thinks and processes information. And this cognitive behavioral therapy for inflammatory bowel diseases, this protocol, she has shown in clinical trials to reduce visual hypersensitivity, so reduces the symptoms of belly pain and diarrhea, as well as, or like the sensation of it, or how much it bothers people in their life. So people might still have it, but they're able to live with those symptoms a bit better and cope better. As well as reduce symptoms of anxiety and depression, improve health-related quality of life. So this is one of the interventions that we're offering. It's a book. And this book is publicly available. You can Google search it, buy it on Amazon, buy it on the publisher's website. As part of the study, a lot of people just don't know about that. Hey, there's this resource available that's evidence-based, that people have done clinical trials on it and lots of patients use it. So we are offering this cognitive behavioral therapy workbook as part of the clinical trial. The exact name, I believe, is Coping with Crohn's and Colitis, and a guide for clinicians and patients for cognitive behavioral therapy, something like that. But if you Google search it, Melissa Hunt, you'll be able to find that book. The second intervention that we have is an app. It's called My IBD Care. And what that is you can download it on Apple's iPhone, on Google, My IBD Care. And what that is allows patients to track their symptoms, track their medications, appointments, and also has educational resources that you can access on demand, whether it's videos as well as programs that help with people learning about sleep, learning about stress, learning about managing medications. So different self-paced programs that are more behavioral programs that help people cope and live with IBD. So my IBD Care app is number 2, and number 3 is the last two actually is both offered by the Crohn's and Colitis Foundation. So you may know about it already. One of them is the peer-to-peer support mentorship program, the Power of Two. Power of Two is its name. So some of the audience may already be familiar with it. It's a one-to-one peer mentorship program that you connect with another patient with IBD based on features that you want to choose, whether it's like IBD type, whether they've had surgery, what type of medications they're on, etc. And that allows patients to have peer mentorship, talk to someone else who's lived through the disease and ask questions, whether it's like, hey, I'm going to get pregnant. What is pregnancy with IBD like? You can go through this peer mentorship program and select based on these characteristics. Or, oh gosh, like my doctor said I might need surgery for Crohn's disease, and you're like, I have no idea what living with an ostomy is like. Is it scary? Can I, go grocery shopping? Can I go swimming? Can I take care of my kids? And you want to talk to another person, but you don't know of any person. And so this peer mentorship program will allow you, through the Crohn's and Colitis Foundation, to connect you securely one-on-one with another patient based on, let's say, who has surgery, who has an ostomy, allows you to select these features. And all these peer mentors are already trained and selected by the Crohn's and Colitis Foundation. So it's not, some random person that it's someone who's vetted for, who's been, interviewed by the Crohn's and Colitis Foundation. So the Power of Two is a peer mentorship program. That's the third intervention we're offering through the study. And number four, the last one, again, another resource from the Crohn's and Colitis Foundation is the IBD Help Center, which is actually the phone number and the email address you mentioned in the very beginning. So patients can connect through there. That allows patients to connect by email, by phone, by online live chat with a person, not a bot, but an online live chat person as an information specialist to get resources asynchronously or synchronously. So they tell me they get over 1,000 inquiries per month. So they're very capable of addressing patients' questions, whether it's regarding insurance or medication types or disability forms, etc. They don't provide medical advice. That should be discussed with a doctor, but they're information specialists. And the people who respond to these questions have a master's degree. And again, they're hired and trained by the Crohn's and Colitis Foundation. So there's a lot of resources out there, but this is a credible resource. So those are the four interventions that are already existing that you don't have to be part of this study to access. But part of my study allows to disseminate and to actually test how well these interventions work in helping people function and helping their health confidence. So, but that's the one part of the study, but you don't need to be in the study to access these resources.
Awesome. And I guess kind of while we're on the topic of the Crohn's Colitis Foundation, besides the Power of Two and the Help Center, are there any other ways the foundation has had an impact on your research?
I say so. Yeah, I think the foundation has been wonderful in supporting my research through grants. For example, they provide the funding. I did get a grant from the IBD Chorus and IBD Clinical Research Alliance, or two separate grants to find basically everything we talked about. It takes time, it takes effort, it takes biostatisticians, it takes talking to patients and that analysis to kind of say everything I've said already. This is not knowledge that's already known. So researchers really finding out new knowledge that we don't know, and then using that knowledge to help patients live better and do better than what they were like before or what they were like 5 years ago, 10 years ago. So doing all this work takes time, takes effort, takes people and intellect and resources. So they provide financial resources for that, for me to allow me to use these interventions to think about these studies to actually trial it on patients. And really, I think this is helps build that. Crohn's and Colitis Foundation has also been very good at partnering with me. So all these resources, they were very open. Again, I didn't create these resources. I didn't create the health center. I didn't create the Power of Two. That takes like a ton of effort and money and organization to do, but they already used it on, and I just said, hey, do you think I can use it in that study to see how well it works to help people feel more confident in managing disease and live better? And they were very open to the idea. So I think even the fact that letting me use these resources and partnering so that we can be synergistic, I think that's fantastic.
Great. And I guess kind of on the topic of the self-help resources themselves, one thing I was wondering is, are there any stigmas that you run into regarding self-help resources? Not maybe in general, just for any care, not just IBD?
Yeah, I would say I think about stigma to self-help resources from two lenses, one from providers' perspective, another from patients. Patients, I feel like I don't want to put any words in patients' mouth, but sometimes patients tell me like, hey, I do seek out information. I look on Google, but they seem to be like, I hope you don't get upset, as a provider. So it's not so much of a stigma, but that I feel like they didn't want to feel like they're undermining their provider by seeking their own resources and advocating for themselves. So, from a provider's perspective, I just want to say, by all means, it's like the patient is the one living with the disease. If I had a chronic disease and was diagnosed, I certainly would look on Google. I certainly would want to find out as much as I can to help myself, right? Because my time with my provider, my doctor, my nurse is very limited, and certainly not everything gets covered. But I think one caveat to remember when we talk about to patients and providers, it's not so much a stigma that you shouldn't look for resources, but make sure that it's a credible resource. So misinformation can be dangerous because if someone says, "Oh, I found on Google, oh, this is that miracle cure for Crohn's disease. I just need to, call this number and pay $100 to this random guy, and I'll be cured." That's dangerous because now you're not getting proper treatment, and it's just paying someone, some money. That's a egregious example, but misinformation, I think it's one that rather than stigma is one that we need to be aware of, both more so for providers and patients. And providers, that's what they fear, is that my patient is not getting the right information. It's not so much that, hey, don't go and talk to Google, it's more like, hey, not everything on Google is right. Anyone can post anything. And it's not like they have the medical training. It's not like they're up to date about scientific literature. It's not vetted. And so be careful about misinformation. And for example, then you do want, on the other side, want true information. And the Chung Sang Tse Foundation, I think, is a good resource. They're very rigorous in terms of what they put out there, what they put on their website, how they answer the IBD Help Center line. So if you want, instead of going to Google, perhaps go to IBD Help Center from Chung Sang Tse Foundation as like your first stop for information. They have a ton of information out there that's vetted by scientists and medical providers and patients, just like you. You review whatever they put up to make sure that it's patient friendly, it's understood by patients, and also, addresses their concerns, let's say about biosimilars, right? Hey, biosimilars, I heard my doctor talk about this. Is this safe? Is it not safe? The IBD Help Center is probably one of the better resources than just randomly Googling and answer a response where anyone can put anything on there.
Gotcha. Thank you for that. And then I also had a question kind of going for the future for your research. Do you have any next steps in mind?
Yeah, so I would say the Empower study is the next step, in which it is using the 4 interventions I talked about instead of patients choosing what they like. Is now, if you sign up for the study, and we're waiting to see probably later in the year to see if we're actually running it. Currently, it's in the planning phase. Is that through the study at University of Pennsylvania, we have a few other sites who are participating too across the country, and it is we assign patients to certain interventions. And why assigning is helpful, because there's a premise that when we talk to our other colleagues, sometimes patients know what they want, but not necessarily what they need. So let's say they're like, I want to get better, but they're not sure how or what they need. So when we randomly assign them, like, you get to use this app, or you get to use the helpline, or you get to use helpline and the book. When we randomly assign people, they can sometimes get exposed to things that they didn't think they need, but then actually helps. So that's the study where those 4 resources, rather than patients just picking what they think they want or need, is that we assign them and then we measure them after to see if it was actually helpful or not. That way we can, talk about once we analyze the data and say, hey, this, resources, the book is actually helpful for people who are, let's say, of certain age demographic, those who are retired, for example, and more time to read books. That's what we find out. Whereas when we assign it to college students, they're like, no, I want the app. So when we assign the app to college student rather than the book, then they do better. So that's part of the randomization of the trial that gives us some more different types of scientific data. So the Empower study is our next step for the research.
Awesome. And kind of as we wrap up the interview, is there any one thing you'd like our viewers today to take away from the research you've done?
Yeah, I would like the reviewers and the patients to know that, providers always have the best intentions in mind. No provider wakes up in the morning like, hey, I just want to get through a day and just, see patients. They really want to try to help patients. And sometimes there's time constraints and financial constraints that, limit their time with patients. So I think self-advocacy is very important for patients, and, seek the information, build that health confidence. So how confident you feel managing inflammatory bowel disease. And one thing I would say is we use this scale from 0 to 10 when we ask patients, how confident do you feel like you can manage inflammatory bowel disease? Just rate it from 0 to 10. 0 meaning not confident at all. 10 meaning very confident, I got this. And the confidence people can change, right, with time. Like I mentioned, if you have a flare, your confidence may go down. If life circumstances change, let's say, some person's job changes or family dynamics changes, that confidence can change, go up or down. So gauging that health confidence and even mentioning to a provider, it's helpful. And when we found that in research is that when someone answers their health confidence is less than 8, so let's say I'm like, hey, what's my confidence level? And there's no right or wrong answer. It's just how you feel. And it's kind of like, how are you doing? You just say how you feel. When someone answers that their health confidence of 0 to 10 is less than 8, sometimes that might signal that you might need more help or want more help. And providers, that's when you want to ask for help with your provider or the Crohn's and Colitis Foundation, peer support, etc. Just as a general rule of thumb.
Gotcha. Thank you so much. So I think that pretty much wraps up our interview here today. Thank you again, Dr. C, for really taking the time to discuss your research on health confidence and self-help for patients with IBD. And for all of our viewers and listeners today, if you have any questions about IBD or participating in research like clinical trials, please visit the Foundation's website at crohnscolitisfoundation.org and the clinical trials community page. And you can also contact the Foundation's IBD Help Center, like we mentioned, by calling 888-MY-GUT-PAIN or emailing info@crohnscolitisfoundation.org. So as always, we recommend you discuss any clinical trial of interest with your healthcare provider. So thank you guys all again for tuning in, and we wish everyone a safe and healthy holiday season.
Take care. Thank you, Nathan.
All right, you too.
Ding, that's a wrap.